Not long ago, a family brought in their young German Shepherd, concerned because she had started aggressively humping pillows and trying to bite at their clothes during play. At first, they thought it was just too much energy, but after a thorough examination, we discovered deeper health and behavioral issues that needed attention. Mounting, or humping, is a normal part of canine behavior. It can be seen in males and females, neutered or not, and in many cases, it's nothing to worry about. However, there are times when humping can be a red flag, signaling underlying medical or emotional problems. Understanding the difference is essential for any dog owner. There are perfectly normal reasons for dogs to hump. Emotional overstimulation is the most common. Excitement during greetings, intense play, or even changes in routine can all trigger mounting behavior. I remember a beagle who would grab his favorite toy and start humping it every time his owners came home from work. It was simply an overflow of joy, not a behavioral issue. Habitual humping can also form if the behavior is left unchecked. Young dogs who find comfort in this action and are never redirected may develop a pattern that continues into adulthood. In these cases, the behavior is not driven by dominance or reproductive instincts but by emotional habits that can be gently reshaped. However, there are times when mounting is not so innocent. When humping becomes obsessive, happens without any clear triggers, or is combined with biting or growling, it may point to deeper problems. Dogs that use humping as a compulsive behavior often show signs of elevated stress or medical discomfort. I remember one German Shepherd whose persistent mounting turned out to be linked to an undiagnosed urinary tract infection. Once treated, the behavior faded almost immediately. Medical causes are important to consider whenever a sudden change in behavior appears. Infections of the urinary or reproductive systems, skin irritations, hormonal imbalances after spaying or neutering, and even pain in the spine or joints can lead to increased mounting behavior. A full veterinary checkup is crucial if mounting becomes frequent, intense, or seems out of character for your dog. Behavioral causes are equally significant. Dogs experiencing chronic stress, changes in household structure, loneliness, or a lack of physical and mental stimulation often develop coping mechanisms, and humping can be one of them. Inconsistent routines, lack of enrichment activities, and insufficient exercise create emotional pressure that some dogs try to relieve through repetitive behaviors like mounting. If you notice mounting becoming a regular, obsessive part of your dog's life, start by observing patterns. When does it happen? What triggers it? Keeping a simple behavior journal for a few days can reveal useful clues. Next, rule out medical issues. A visit to your veterinarian for a thorough examination is essential. If no medical problems are found, the focus should shift to increasing your dog's daily physical and mental activities. Long walks, sniffing games, training exercises, puzzle toys, and consistent social interactions can help channel your dog's energy into healthier outlets. When your dog starts to mount, calmly interrupt the behavior without yelling or using force. Redirect your dog to a toy, a simple obedience task, or a calming activity. Always reward the alternative behavior with praise or treats, reinforcing the choice to engage in appropriate activities. If anxiety is suspected, building a more structured and predictable daily routine can greatly reduce emotional tension. For dogs struggling with more serious compulsive behaviors, consulting a veterinary behaviorist or experienced trainer can be a critical part of the recovery process. Mounting behavior should not automatically be labeled as a dominance issue or dismissed as something embarrassing. It is a form of communication, and sometimes, it is your dog's way of saying that something is out of balance. By paying attention to the context, addressing possible health concerns, and providing the right mix of activity and emotional support, you can help your dog find more appropriate ways to express excitement, stress, or needs for interaction. Early intervention is key, and with understanding and patience, most mounting behaviors can be redirected or resolved, leading to a healthier, happier life for both you and your dog.